Hi, everyone. My name's Chelsea, and I am one of the nurses that supports the Vanderbilt Nurse Residency Program. And I just wanted to record a short info session about some benefits of the Vanderbilt Nurse Residency Program, as well as some of the frequently asked questions we get on how to apply, what are our benefits, what is some of the tracks that you offer, things like that. And so we will go ahead and get started. So first things first, I can't emphasize enough to start off with. Not only do I think that Vanderbilt's nurse residency program has a lot to offer, I would highly consider a nurse residency program in general as a nurse resident, just because it's going to give you, or as a new graduate nurse, because it's going to give you a lot of support during that first year that we know is typically very hard for a new graduate nurse. But now I'm going to speak on things specific to our nurse residency program. So this is just a sweet kind of brief quote from one of our nurse residents who recently started in our medicine step down unit. And she talks about how it's not only a great place for your first career, but it's just a good place to learn and grow, because Vanderbilt does offer a lot of opportunities with interdisciplinary care, critical thinking, things that are going to really help build those core nursing skills to get you through that first year. So just some benefits to our program. So we have 7 hospitals in operation total. We have our adult hospital, Monroe Carroll, which is our children's hospital, behavioral health, which is our psychiatric hospital. We've got 3 regional hospitals, Bedford, Tullahoma, and Wilson County. And then we also have our Vanderbilt Medical Group. Combined, we have over 17,000 licensed hospital beds. We have been magnet designated for 4 consecutive cycles, which we're really proud of. We also, our nurse residency program is accredited through that PTAP accreditation, which means we really focus on that transition to practice, that hard first year. We have been shown that we really provide resources and support to help you through that really transitional time as you're going from a student into a professional nurse. We offer a lot of support. We offer peer support through a Teams channel. We offer a lot of education support, both classroom, simulation, as well as on the floor on your units. We pair you up with preceptors. But in addition to that, we also offer a mentorship. So after you get off orientation, we pair you up with a mentor, someone to also be a person that can walk along those struggles, those hardships, those things that you're struggling with during that first year. In addition to the education, we offer workshops during that first year, things that are geared towards those things that nurses say are hard during that first year, things related to ethics, delegation, communication, all those things that can really help. And with that, we have a 92% attendance, which just shows how much our nurses say that they're helpful because they come to them. At 1 year, 96% of our new graduate nurses are satisfied with the program. And we also have a 94% retention rate at 1 year. So people don't go running for the hills during that first period. Some highlighted benefits. So this is not an exhaustive list. This is just a few that we like to emphasize. So we do offer a nursing tuition benefit. So after you've been employed for 1 year, you are eligible to use this benefit to go back to school, whether it's for your bachelor's, your master's, any of those types of things. And then you can have up to $24,000 over 3 years to help you with that. We also have a loan repayment. You're eligible for this after you've been employed for 3 months. And the UMC will contribute up to $500 a month, up to $24,000 of your student debt. We also have My Health Bundles. So this helps cluster and clump different things that you would need for certain health conditions to help streamline care. It also helps decrease out-of-pocket costs, just because all of the services that you're going to get are in our top tier. And this is in addition to like insurance and those types of things. And so these are just a few of the bundles. We have a lot more that are on our website. We also offer sign-on bonuses. They're typically anywhere from $5,000 to $15,000. They are unit specific, and we do review these every cohort, and our bonuses are listed in the application. Relocation assistance, we also offer that. It's calculated based on how far away you live. It can be up to $10,000. So if you're coming to us from Hawaii or Alaska, most likely you're going to get that whole $10,000. Where if you live maybe in Kentucky or South Georgia, you would get anywhere from like $2,000 to $5,000. It really just depends. We have a calculation on how far away you live, and it's based off the address that you supply during your application. So when do I apply? So for our summer 2025, those start dates are going to be July 21st and 28th, depending on which unit you start on. But this is the really important piece, is that if you have any interest in what we consider high interest areas, so women's health, pediatrics, adult ICU, adult ED, OR, any of those types of positions, it's really important for you to get your application and your video interview in by October 15th. This is what we kind of consider our first deadline or our priority deadline. And that's what's going to really help you get that hiring conversation for one of those high interest areas. We do keep our application open after that, but typically a lot of our high interest areas, women's health, peds, ICU, fall off because we filled those positions. So how do I apply? So first things first, it is an online application. So you would just go to our website here to apply. You would fill out your application for the summer cohort. We do have multiple cohorts open currently, so make sure you click on the correct application. And then in addition to filling out your personal information, you're also going to pick your top 4 unit preferences. And we'll talk more about how to pick your preferences in just a second. Also, we've got our recorded video interviews. So after you've submitted your application, within 24 hours, you'll get an email from us with your video link. You're going to click on that, and there's going to be 5 questions, and you're going to record your answer to each one of those questions. And we're going to talk more about this as well on the next slide. In order for your application to be complete, you have to submit your application and your video interview. Once you've done that, we consider your application complete, and we are ready for you to move on to the next phase. So if you apply during that early window, that September to October 15th, after that October 15th deadline, we are going to do our song and dance to figure out which unit you'll go to get your hiring conversation. And then within that week, you should get communication from our team that says which unit you will receive a hiring communication. And then after that, you will get independent communication from the unit to schedule a hiring conversation via Teams. So it will be virtual. So your recorded interview, this is your real interview. And so I always like to share that so that way everyone knows that this is your real interview. So it's really important when you're having this recorded interview that you're mindful of background noise in your surroundings. So make sure that you have a quiet place with a neutral background where you're not going to have the dog barking and those types of things. Also, be professional, dress professional. Can't emphasize this enough. Practice. Do your research. We're going to show you how you can find more information about the units in just a second. And then you can record your videos as many times as you want. So if you record your video and you're like, yeah, I didn't really love that, you can throw it in the trash and you can start again until you click submit. And then once you click submit, then it's finalized and comes to our team. So how do I pick my preferences? What do I do if I'm on the fence? So if you're like, man, I know that Vanderbilt has a lot to offer and I'm kind of in between these 2 or 3 units, but I don't really know because I didn't get to do clinicals on them. And I just know what I've kind of heard from other people. This is a really great resource for you to go to kind of get that extra info. So we're actually going to go to the website. So I'm going to click down on our website here. And so you're going to see our little squares pop up and say that track options apply now. So we've got all of our different options. And so we'll say that you're interested in pediatrics. So we're going to click on pediatrics, and it's going to pull up all of our pediatric departments. So you're going to be able to see a brief description, the nurse to patient ratio, the number of beds. But let's say you're really interested in pediatric cardiology and you want even more information. You can click for more details, and then it will show you who the manager is, as well as a brief description, extra details, professional growth, those types of things. Alrighty, so you're going to pick your top 4 preferences whenever you do your application, and this is that good resource for that if you're unsure of what your top 4 preferences are. Next, we're just going to briefly hit on some of our frequently asked questions. So how much do we pay? It's not all about money, but money's nice to have. So most of our units pay $32.50, with the exception of our regional hospitals and our ambulatory clinics. So they offer $31 an hour. We do offer shift differentials that you can see here. So if you work night shift or a weekend shift, you can make extra money that way. We get asked a lot, is day shift available? And we always tell nurse residents to prepare to go to night shift for some period of time. Now, there are exceptions to that where sometimes nurse residents can go straight to day shift, but that's typically atypical. And so we always say plan to go to nights. The only exception is like our ORs and our like ambulatory areas. They do have a lot of day shift offerings there. We also get asked, do I have to pass the NCLEX? Yes, you do have to pass the NCLEX prior to your start date. And so if for some reason, we're always going to address the elephant in the room, if you don't pass, what happens? We are able to defer you to the next start date, up to 2 deferrals, and then we would ask you to reapply to the program. So briefly talked on this. What is ambulatory? Ambulatory is our clinics. So not our surgery centers, but like our primary care, our specialty clinics. We have a lot of different clinics that participate, that take nurse residents. And so if you get hired into the ambulatory track, you're actually going to get to go to something that they call match day, where you get to kind of do a speed dating and they pair you up with the unit that they think you're going to be a good fit with and that you liked speaking with. So that's kind of a fun thing. And those tracks or those clinics that participate in each cohort change every time. And then I always like to address this. So why acute care? I know a lot of the reasons that nurse residents or students come to Vanderbilt is because we offer a lot of those specialty areas. But there is so much or such a large benefit to acute care, because you're really going to learn core nursing skills, things related to assessment, communication, medication administration, charting, time management. I could go on and on, but there's so much there. And so if you're ever on the fence, you want to talk more about acute care and what it looks like, don't hesitate to reach out to either myself or Candace, my partner in crime, to talk through those things with you, because acute care looks very differently at Vanderbilt than what you would see at some outlying hospitals, because we have a lot of highly specialized step down areas, adult medicine units, a lot of things that could really help build your core nursing skills. And then if you have any more questions, I've listed both my contact information as well as Candace's and the different clinical areas we support. We both support adult acute care, but I do peds, ambulatory, and women's health, whereas Candace does adult ICU and the regional hospitals as well. And then if you have general questions, don't hesitate to email them to our VUMC nurse residency at vumc.org email address, and we'll get back to you as quickly as we can. Thank you so much for listening, and we look forward to any questions that you might have. Have a good one.